When you're helping an aging loved one with personal hygiene, you're stepping into one of the most intimate and important parts of caregiving. And it's about so much more than just, keeping clean. It's really about their dignity, their health, and their sense of who they are. So in this explainer, we're going to walk through the essentials of providing that kind of respectful, compassionate care.
And this quote, man, it just hits the nail on the head. Simple things like combing someone's hair or trimming their nails are so directly tied to their confidence. It affects whether they want to see people, to get up and face the world. So when we help with grooming, we're not just checking a box, we're helping to nurture their spirit.
So that's the big question, right? It's a really delicate balance. You want to provide support, but you don't want to take away their feeling of independence. This explainer is all about walking you through the practical steps and, just as important, the right mindset to get that balance just right. And it's so true. The impact goes way beyond just the physical. I mean, of course, poor hygiene can lead to things like infections and skin issues, but it also hits their mental health hard. When you don't feel good about yourself, you might start to pull away from friends and family. So the key takeaway here is that this is about their whole well-being. Okay, so where do we start? Let's break down the most important areas of personal care, the stuff that really forms the foundation for good health and comfort. It's kind of wild how much oral health is tied to our overall health. It's not just about, fresh breath or avoiding cavities. If it's neglected, it can lead to some really serious problems. Things like aspiration pneumonia, or even making heart conditions worse. It's a much bigger deal than a lot of us think.
So here are the basics, and a great little pro tip. For anyone with dentures, when you're cleaning them, put a towel down in the sink first. That way, if you accidentally drop them, they're much less likely to break. And remember, always let the person do as much as they can by themselves before you step in to help out.
Think about it. For so many people, their hair is a huge part of who they are. So taking the time to wash, brush, and style their hair the way they like it, that's such a powerful way to honor their identity. Plus, a gentle brushing feels good, it helps circulation in the scalp, and it prevents those painful tangles. Okay, here's a really practical technique for you, especially if you're dealing with tangled hair. Hold the hair close to the scalp with one hand while you brush with the other. This stops it from pulling, which makes the whole experience so much more comfortable. It's a small detail, but it shows you're taking extra care. All right, let's talk about something that's super easy to overlook, but is actually so important. Nail care. For seniors who have diabetes or poor circulation, even a tiny cut or an ingrown nail can turn into a serious infection. So regular, careful nail care isn't just about looks, it's a huge part of preventative health. Now, when it comes to technique, trimming straight across is the way to go. It's the safest way to prevent painful ingrown nails. And while you're at it, just take a quick look at their hands and feet. Check for any swelling or changes in color. It turns a simple task into a quick little health check. For someone who can't get to a shower or a tub, a bed bath is absolutely essential. Now, I know it can seem a little intimidating at first, but if you break it down into a clear process, it's totally manageable for any caregiver. So let's walk through it. So you've basically got two main options here. On one hand, there's the traditional basin bath, and a lot of folks just prefer the comforting feel of warm water. On the other hand, you have the bag bath, which uses these pre-moistened cloths. It's a really efficient option, and it can also help reduce the risk of spreading bacteria. The best choice really depends on what the person prefers and what's practical. Okay, here's the game plan, broken down into 6 simple steps. The absolute key here is preparation and communication. Get everything ready before you start. Talk them through each step before you do it. And this is so important. Step 5, only uncover the part of the body you're washing at that moment. It keeps them warm and, most of all, maintains their dignity. Okay, so we've gone through the what and the how. But what's maybe even more important is the why. And, well, how it all feels for the person you're caring for. So let's really focus on the heart of it all, preserving their dignity. This is the question we should be asking ourselves every time. It's all about a shift in your mindset. You're not just cleaning a body, you're caring for a person. And the way you approach it, well, that makes all the difference in the world. Think of these as your 4 golden rules. Honoring their choices is huge. Using their favorite soap, the lotion they've used for years, or maybe putting on their favorite old tunes in the background. These little things transform a routine into a personalized, comforting experience. All right, let's pull all of this together into a super handy, simple checklist you can use every day to make sure you're covering all the bases. This checklist is great because it brings everything together. You can see how for every single practical action, there's a dignity tip right next to it. Whether it's letting them choose their own outfit for the day or making bath time a little more relaxing, it's these small things that really define great, compassionate care.
And that's really the question we want to leave you with. Because when we approach personal care with patience, with respect, and with empathy, it stops feeling like a chore. It can actually become a quiet moment of trust, a chance for a little conversation, and a really powerful way to show someone that they are seen, that they are valued, and that they are loved.